What is coronavirus? Coronaviruses are a type of virus. There are many different kinds, and some cause disease. A newly identified type has caused a recent outbreak of respiratory illness now called COVID-19 that started in China. Lauren Sauer MS, the Director of Operations with the Johns Hopkins Office of Critical Event Preparedness and Response and Director of Research with the Johns Hopkins Biocontainment Unit, shares information about COVID-19 and what you need to know. Where do coronaviruses come from? Coronaviruses are circulating in animals, and some of these coronaviruses have the capability of transmitting between animals and humans. We call that a spillover event. How is COVID-19 spread? Recent information indicates COVID-19 may be passed from person to person. Community spread is being seen also. Community spread means people have been infected with the virus in a particular area, including some people who are not sure how or where they became infected. COVID-19 has been detected in people throughout China and in over 100 countries, including the United States. The spread of new coronaviruses is being monitored by the Centers of Disease Control (CDC), the World Health Organization, and health organizations like Johns Hopkins across the globe. On January 30, the World Health Organization declared the COVID-19 outbreak a public health emergency. How did this new coronavirus spread to humans? COVID-19 appeared in Wuhan, a city in China, in December 2019. Although health officials are still tracing the exact source of the new coronavirus, early hypotheses thought it may be linked to a seafood market in Wuhan, China. Some people who visited the market developed viral pneumonia caused by the new coronavirus. A study that came out on January 25, 2020 notes that the individual with the first reported case became ill on December 1, 2019 and had no link to the seafood market. Investigations are ongoing as to how this virus originated and spread. What is incubation period for COVID-19? It appears that symptoms are being showed up in people within 14 days of exposure to the virus. What are the symptoms of COVID-19? COVID-19 symptoms include cough, fever, shortness of breath, runny or stuffy nose, sneezing, sore throat, headache, fatigue, chills, body aches. In rare cases, COVID-19 can lead to severe respiratory problems, kidney failure or health. If you have a fever or any kind of respiratory difficulty such as coughing or shortness of breath, call your doctor or a healthcare provider and explain your symptoms over the phone before going to the doctor's office, urgent care facility or emergency room. Over the phone, be sure to tell them if you have traveled outside the country in the last 14 days, particularly to countries affected by COVID-19, currently China, Iran, Italy, Japan, and South Korea. Also be sure to tell them if you suspect you have been close within 6 feet of someone who has COVID-19 for an extended period. Your healthcare provider or the emergency room team will recommend next step. How is COVID-19 diagnosed? Diagnosis may be difficult with only a physical exam because mild cases of COVID-19 may appear similar to the flu or a bad cold. A laboratory test can confirm the diagnosis. How is COVID-19 treated? As of now, there is no specific treatment for the virus. People who become sick from COVID-19 should be treated with the supportive measures, those that relieve symptoms. For severe cases, there may be additional options for treatment, including research, drugs, and therapeutics. Does COVID-19 cause death? As of March 12, 2020, 4,718 deaths have been attributed to COVID-19. However, 68,310 people have been recovered from the illness. This information came from the coronavirus COVID-19 global cases map developed by the Johns Hopkins Center for Systems, Science and Engineering. Is the coronavirus different from SARS? SARS, SARS, stands for Severe Acute Respiratory Syndrome. In 2003, an outbreak of SARS started in China and spread to other countries before ending in 2004. The virus that causes COVID-19 is similar to the one that caused the 2003 SARS outbreak. Both are types of coronaviruses. Much is still unknown, but COVID-19 seems to spread faster than 2003 SARS and also may cause less severe illness. How do you protect yourself from the coronavirus? coronavirus. The Center for Disease Control and Prevention (CDC) has these suggestions. Wash your hands frequently and thoroughly for at least 20 seconds. Use alcohol-based sanitizer if soap and water are not available. Cover coughs and sneezes with a tissue, even though the tissue is in the trash. Avoid touching your eyes, nose, and mouth with unwashed hands. Stay home when you are sick. Clean and disinfect surfaces and objects people frequently touch. What are the precautions for coronavirus? Several health agencies in China and other countries, including the Centers of Disease Control (CDC) in the United States and the World Health Organization (WHO), are keeping a careful eye on this illness and taking steps to prevent it from spreading. About coronaviruses. Coronaviruses is common in different animals. Rarely an animal coronavirus can infect humans. There are different kinds of coronaviruses. Some of them can cause colds and other mild respiratory, nose, throat, lung illness. Other coronaviruses can cause some serious diseases, including severe acute respiratory syndrome and Middle East respiratory syndrome. Coronaviruses are named for their appearance. Under the microscope, the virus look like they are covered with pointed structures that surround them like a corona or crown. Who is at increased risk? You are at the high risk of contracting SARS-CoV-2 if you come into contact with someone who is carrying it, especially if you have been exposed to their saliva or been near them when they have coughed or sneezed. Older men seems to be especially susceptible to the virus. A late January report by World Health Organization found that the median age of people testing positive for coronavirus was around 45 years and that over two-thirds of those people were male. What treatments are available? There is currently no treatment specifically approved for COVID-19 and no cure for an infection, although treatments and vaccines are currently under study. Instead, treatment focuses on managing symptoms as the virus runs into course. Medical help. If you think you have COVID-19, your doctor will recommend treatment for any symptoms or complications that develop. Other coronaviruses like SARS and MERS do have vaccines and treatments. Some treatments for these similar viruses include antiviral or retroviral medication, breathing support such as mechanical ventilations, steroids to reduce lung swelling, blood plasma transfusions. Other types of coronaviruses. A coronavirus gets its name from the way it looks under a microscope. The word corona means crown. When examined closely, the round virus has a crown of proteins called peplomers jutting out from its center in every direction. These proteins help the virus identify whether it can infect its host. Known as severe acute respiratory syndrome (SARS), was also linked to a highly infectious coronavirus back in the early 20s. The SARS virus has since been contained and the condition found to be successfully treatable. COVID-19 versus SARS. For the first time a coronavirus has made news. The 2003 SARS outbreak was also caused by a coronavirus. As with the 2009 virus, the SARS virus was first found in the animals before it spread to humans. The SARS virus has come from bats, then transferred to another animals, and then to humans. Once transmitted to humans, the SARS virus began spreading quickly among people. What makes the novel coronavirus so newsworthy is that a treatment or cure has not yet been developed to help prevent its rapid spread from person to person. SARS has been successfully contained and treated. Impact of coronavirus over the society. National emergency declared. Drive-through testing to be rolled out nationwide. During a press conference held Friday, March 13, President Trump declared a national emergency orders I am issuing today will also confer broad authority to the Secretary of Health and Human Services, said Trump. The Secretary of HHS will be able to immediately waive provisions of applicable laws and regulation to give doctors, all hospitals and healthcare providers maximum flexibility to respond to the virus care for patients. The declaration will allow access to $50 billion earmarked for disaster relief. He stated that the administration has been in discussion for pharmacies and retailers to make drive-through testing available in critical locations identified by public health professionals. The goal is for individuals to be able to drive up and be swabbed without having you leave your car. The creation of screening website was also announced that will enable visitors to fill out a screening questionnaire, check symptoms and risk factors, and it found necessary, be informed where the nearest drive-through facility is located for them to receive tests. South Korea, widely praised for its testing measures, has been using drive-through sites to great effect, according to CNN. New York State is also one of the first state to introduce the practice so far. Who says Europe now the center of the outbreak? In a briefing to the reporters, Dr. Tedros Ghebreyesus, the Director General of the World Health Organization, said Europe is now the center of the COVID-19 outbreak. More causes are now being reported every day than were reported in China at the height of its epidemic, he said. Italy is currently on virtual lockdown as the medical system, especially in the northern region of the country, has become overwhelmed. President bans travel from Europe. Biden speaks about outbreak. The spread of COVID-19 has started to take a toll in the United States in both large and small ways. President Donald Trump and former Vice President Joe Biden both took the opportunity to explain what they believe are the most effective actions we can take against the current COVID-19 crisis. In only the second Oval Office address of Mr. Trump's presidency, he laid out his plan to deal with the health crisis currently facing the United States, one facet of which is restricting international travel. To keep new cases from entering our shores, we will be suspending all travel from Europe to United States for next 30 days. The new rules will go into effect Friday at midnight. These restrictions will be adjusted subject to conditions on the ground, said Trump during his address. Former Vice President Joe Biden, in his own speech on the epidemic, emphasized the universal nature of the risk COVID-19 presents. The disease could impact every nation and any person on the planet. We need a plan about how we are going to aggressively manage here at home, said Biden. He also forcefully disagreed that restricting travel is an effective method of containing the virus. NBA suspends season. March Madness tournaments cancelled. The NBA has suspended the rest of the season after the player on the Utah Jazz tested positive for the virus. Players on 5 other teams the Jazz played in the recent days will also need to be quarantined. Team officials announced a second player on the team had tested positive for the virus as well. New York Governor Andrew Cuomo announced a ban on gathering 500 people, which effectively means all shows on Broadway will be cancelled. The president of the NCAA announced that the iconic March Madness basketball tournament will be cancelled. In addition to these major cancellations, celebrities are now being affected by the virus. Actor Tom Hanks and his wife Rita Wilson announced on Twitter they have contracted novel coronavirus. They were in Australia where Hanks is shooting a movie when they started to develop symptoms. Research finds a new ways virus can spread. Researchers are studying how people who have contracted the virus shed it and what impact that's having on affected populations. One new study has found answers that many won't find comforting. Testing and confirmations of SARS is currently carried out by oral swabs, but research published February 17 in Emerging Microbes and Infections finds evidence that there is an oral facial transmission route. Respondents reported that its genetic material was detected in both anal swabs and blood samples. We detected the virus in oral swabs, anal swabs and blood. Thus, infected patients can only potentially shed this pathogen through respiratory, fecal, oral, or body fluid routes, the study authors wrote. Chinese researchers conducted the study in Wuhan, China hospital and analyzed samples collected from about 180 patients. Crucially, evidence of coronavirus was found in anal swabs and blood, even when it was not detecting using oral swabs. According to the study, this was particularly true for those people receiving supportive care for several days. Finding also suggests that timing is an important factor. One day, one of the illness, 80% of world swabs were SARS-CoV-2 positive, but on day 5, 75% of anal swabs were positive, while only the half of the oral swabs showed infection, according to the study. These results confirm that COVID-19 patients have live virus in stool specimen, which is a new finding in the transmission route of 2019 coronavirus, wrote authors of the study published by the CCDC publication CCDC Weekly. This means that sneezing is not the only way for your transmission. Blood and fecal matter can carry the virus, even when conventional testing comes back negative. The virus can also be transmitted through the potential fecal-oral route. This means that stool samples may contaminate hands, food, water, etc. and may cause infection by invading the oral cavity, respiratory mucosa, conjunctiva, etc. Study author concluded. Thanks for watching. If you like the video, please subscribe to my channel. Hit the like button below and please don't forget to share this video with your friends.